Face masks have become a symbol of the coronavirus pandemic, but guidance from the Centers for Disease Control and World Health Organization has indicated that only sick individuals and those caring for them should be wearing masks.
A lot of their guidance is really focused on what we know about something called N95 respirators. They're the masks that people have to wear in hospitals when they're doing these dangerous procedures called aerosol generating procedures where the virus can become airborne. Unless you've got some kind of home surgery going on, then you don't need an N95 respirator. Leave those for the hospitals.
Though N95 respirators should be reserved for healthcare workers, some have had to use homemade masks as hospitals experience shortages.
Recent research from MIT and Stanford has shown that when we speak, little saliva microdroplets come flying out of our mouth 6 feet or more. It depends how loud we talk, it depends what specific thing we're saying, but there's always this little stream of droplets. Those droplets, if you're infected, contains millions of particles of virus. So we all know that if you have a spray bottle with some water in and you hold a t-shirt in front of it and spray, the spray hits the t-shirt and doesn't go past it, or the vast majority of it doesn't go past it. We just need some kind of cloth barrier between your mouth and the people around you.
Everyday people have also started making their own masks to wear in public. Research scientists like Jeremy Howard say that despite guidance from the CDC, healthy people wearing masks is a good step towards slowing the spread of the virus.
Cambridge University studies show that 2 layers of cotton work pretty well. Hong Kong scientists have shown that nearly the perfect thing is actually kitchen paper towel. So what I actually do is I cut up a t-shirt. So you've got 2 layers of cotton now, and I put a piece of paper towel between them, and I just tie it onto my head. And then at the end of the day, I throw away the paper towel and I wash the cut up t-shirt with soapy water.
In terms of materials for DIY masks, Howard suggests simple fabrics you might find around the house.
The best thing to do would be just to use the materials that scientists have already tested. And so that would be a good quality cotton. If you've got an old bed sheet, that's a really good quality cotton, ideally along with paper towel. The approach that the Hong Kong Consumer Council recommend and have documented on their website is just a paper towel with a transparent plastic cover. When I came across this idea of mask wearing being important, it didn't feel great to me because I didn't like the idea of going out and about in a mask because it just made me feel weird. Nowadays, after doing it for a while, it makes me realize if I'm not wearing a mask, I'm putting my community at risk, and that just feels like an awful thing to do.